Good afternoon. Please welcome to the Penn Dental Medicine class of 2030.
Dear students, families, and invited guests, welcome to Penn Dental Medicine and welcome to the University of Pennsylvania. You have chosen to come to school which is rich in its traditions, spanning 3 centuries, and yet one which is always in front of innovation. Our vision and philosophy, among others, include fostering humanistic environment, delivery of high-quality evidence-based patient care, shaping the global and dental profession, promotion of interdisciplinary collaborations which accelerate innovation and scientific discovery, and mentoring exceptional leaders. One of Penn Dental Medicine's strengths is its good fortune to be located within walking distance of Penn's other 11 graduate and professional schools. Our unique, vibrant campus enables us closely to collaborate in teaching, research, and community outreach in ways which are unimaginable at other dental schools. Indeed, our students and faculty work together with the schools of medicine, law, engineering and applied science, Wharton School of Business, veterinary medicine, nursing, as well as the School of Social Policy and Practice. In addition to obtaining superb education, the opportunities to enrich your education via selective courses, enrolling in senior honors programs, obtaining dual degrees with our sister schools, attending hospital-based externships, engaging in research activities and community-based programs are all second to none. We admire your determination, discipline, and the personal and financial sacrifices you had to make to get to this point. I speak on behalf of the entire Penn Dental family in assuring you of our dedication and commitment to make you proud of your decision to attend Penn Dental. We wish you the best and all the success in the world. Thank you. It is now my pleasure to invite our Morton Amsterdam Dean, Mark Wolf.
Hi, everybody. I'm a crier. Distinguished guests, esteemed faculty and staff, proud families, and most of all, our future graduates. Welcome. Today marks one of the great milestones of a professional career. The white coat you receive is not a reward for having arrived here, but rather it's a commitment from you about how you will travel. The white coat is a relatively new ceremony that was developed by a group of physicians at Columbia University in the mid-90s. And it was an attempt at that time to get the incoming students to recognize the gravity of what they were doing. It represents the acceptance of the scientific discipline, the ethical responsibilities, the humility and service that is upon you. Above all, it's a commitment to see and care for human beings who place their care in you, in your trust. You enter a school with a deep history. Penn Dental Medicine traces its history to the Philadelphia College of Dentistry in the early 1800s. It was established in 1852, and in 1878, under the leadership of Charles Essig, the College of Dental Surgery was created at the University of Pennsylvania. It was later renamed the School of Dental Medicine. Our current Evans building was made possible by the extraordinary generosity of Dr. Thomas Evans, a dentist to European royalty. He grew up actually on the corner of Spruce and 40th Street, where our current building is. He did not attend Penn Dental Medicine or the Pennsylvania College. He learned dentistry by interning with another dentist. When he passed away in 1897, he left an endowment to our school with a charge to build a school second to none. And we have done that. It is not just a mere history or a collection of dates and buildings, Penn Dental Medicine. It is a living, continuing body that has the obligation to utilize the best of science in the service of others. You benefit from the work of those who came before you, and your obligation will be to contribute to that work in the future. Our tradition of scientific pioneering started in our very first class. W.D. Miller graduated in 1879. In our first class, he opened a practice here in Philadelphia, didn't do so good in practice, went off to go work in the Koch laboratories in Germany, and he went ahead and wrote what was one of the most important documents for dentistry. His 1890 text, The Microorganisms of the Human Mouth, written in German, so none of the American dentists actually understood what was written there, talked about the cause of tooth decay, which to that moment, by the way, this will be a question on an examination in the future, so get it right. I still do teach our students routinely, and Mr. Cavity is my area. The cause of tooth decay before W.D. Miller got there was actually thought to be the tooth worm, or maybe rotting food on the surface of the tooth. But nobody ever thought that it might be bacteria that eat sugar, poop acids, and dissolve tooth. You're done with dental school now. That's all the microbiology you need to know about Mr. Cavity. It changed dentistry. It was an inquiring mind. It was an inquisitive person. It was somebody that just did not accept the things that he was taught at that moment, but looked for more going forward. It shifted the profession and made prevention possible. In 1901, a graduate named Fred McKay graduates Penn Dental Medicine. He moves out to Colorado, and he sees these absolutely ugly teeth. He later writes a treatise with this insignificant dentist, G.V. Black, that will be on an exam also, so remember G.V. and what the middle name stands for. You'll have to look that up. On model teeth, what he had discovered was that high doses of fluoride may cause the teeth to look discolored and mottled, but his sense of inquiry went much further than that. He noticed that none of these patients get tooth decay. And it was he that actually discovered that doses of fluoride can prevent tooth decay. He could have ignored it. But his sense of inquiry, his desire to find science, his desire to understand led to a breakthrough that later became a mainstay of dentistry. And yes, we will talk about fluoride in the future, and we will talk about the science around it. And failing to use it will result in generations of people that will have tooth decay. Dr. Louis Grossman, a faculty here, disbelieved a science that said that infected teeth couldn't be saved, they needed to be extracted immediately. He created the field of endodontics. Dr. Lester Burkett came to our school, goes ahead and studies the interaction between systemic health, oral health, and the bidirectionality of it. There is not a dentist alive who hasn't looked at Burkett's textbook on oral medicine. We have been the pioneers that develop the science, not the people that read it. Oh, we do read it, and we do look to understand it. Their achievements remind us that progress begins with curiosity, but it has a purpose to relieve suffering of individuals, to prevent disease, and to improve human lives. The science you learn here will be exacting and evidence-informed, not talking about what I heard or they said. My wife is famous for coming to me and saying, they say you shouldn't do this. Who is they? What right did they have to say it? Now, having been married for almost 50 years, she is always right, even when what they say is wrong. But that being said, I question who is they every time she says it. The science you learn here will be exacting, evidence-informed, and you will have to start to learn how to discern what the evidence we're staring at. You will learn anatomy, physiology, materials, diagnosis, prevention, treatment. You will learn the techniques of dentistry. You will learn to evaluate evidence, utilize emerging technologies wisely, and recognize the limits of what is known and what we still need to learn. Clinical excellence requires more than technical skill, though. A perfectly executed procedure still falls far short if the person receiving it feels unseen, unheard, or diminished. Every patient who sits in your chair brings a story. Some will arrive confident, others they said, if you snap a rubber band, my wife told me to do that. It doesn't stop me from getting teary. Some will arrive confident, many will arrive afraid. Some will have postponed care because of the cost, because of a disability, because of distance to the office, because of trauma, mistrust, and competing responsibilities. We have to find the patients where they are. We have to learn to communicate with them. We have to make sure that they understand they are seen. We have to recognize that they have burdens that we can't see easily. Before you interpret the radiograph, you must learn to understand the person. Understanding begins with listening, not waiting to speak, not rushing to correct the person, listening with intention and learning from them. Ask open-ended questions. Ask what matters to them. Explain your findings in language they understand, not language that shows how smart you are. Invite questions. Confirm that they're truly consenting. When a patient hesitates, do not assume that that hesitation reflects distrust in you. As a practitioner, you should not feel uncertain because somebody asks a question of you. It may be a life circumstance for them. You have not yet learned what makes that patient feel that way. It may be embarrassment, lack of understanding. Motivational interviewing, that's also one of the test questions that will come. Ask open-ended questions and then shut up and listen. Don't come with the answer, wait to hear the answer. Watch the patient. There's nothing better today. All of you have gone to see primary care or physicians. They sit now at a keyboard. When did you see the doctor last? What did you do? They don't look at you. Yet communication is very clearly seen with the eyes. It's the hesitation, it's the facial expression. Your patients will not remember every technical term you give them, but they will remember whether you treated them with dignity. They will remember whether you noticed their discomfort, whether you respected their choices, whether you made room for their voice. Expertise earns confidence. Humanity earns trust. Finest clinicians bring both. At Penn Dental Medicine, we ask you to become a discerning interpreter of the evidence and a compassionate partner to care. You have to assist your patients in understanding best evidence. When the patient questions your recommendations, recognize that they come with a horde of misinformation and they may hold beliefs that are different than your own. Your task is not to win the argument. Your task is to help them understand, communicate honestly, offer best evidence, preserve the relationship between you and them. Make good care possible by having them understand the care they need. The white coat has become a symbol of cleanliness, thanks to the science of Joseph Lister. It was just a little over 100 years ago that somebody discovered that, spitting on your hands before doing surgery is not a good idea. It's actually hard to believe that it's that recent that these things occurred. The white coat has become symbolic of the conduct, though, of a healthcare provider, both the cleanliness and the wisdom. The coat doesn't make you more important than the person before you. It asks you to become more accountable to that person. It never should create distance. Sit alongside your patient. Don't sit opposite them. It should remind you that you have to cross the distance to them. They don't have to cross the distance to you. So when you put on the coat, I ask you to do 5 different commitments. Be curious, enough to keep learning for a lifetime. Be humble enough to say, I don't know. Don't make up a story. My wife has trouble with that one. She'll ask me a question, and I will respond, I don't know. That's honest. It's not blowing off the person. But we have an obligation to our patient when they ask the question and you say, I don't know, to also say, but I can help find out. And that's the curiosity piece that's also part of our warranty. Be courageous enough to advocate for those whose voices are often overlooked. Be attentive enough to listen before you act. And be humane enough to treat every patient as a whole person, never simply as a diagnosis or a procedure. It's very easy to say, I'm treating the crown in chair number. You're never treating the crown. You're treating a patient. You will care for people across differences of culture, of language, of ability, identity, and experience. They will have different financial means. They will have different belief systems. Equity in healthcare is not providing every person with the exact same thing. It means making the effort to understand what each person needs and customizing the care you deliver. There will be difficult days. You will make mistakes. Admit. Find a better way of doing things. You will encounter uncertainty and fatigue. You will have days that are better or worse. It's important to be able to say, we shouldn't do this today. Your patient deserves that. In those moments, professionalism means seeking help, learning openly, repairing trust, returning to the values that brought you here. Compassion includes extending grace to your colleagues and to yourself. You have an obligation to those around you at all times. Oral health is a team endeavor, and humane care grows in humane learning environments. We hope to provide one. To the family and friends, I only promise that this will be difficult. Be there and support them. To you guys, be grateful to them. It's important. To the class of 2030, 4 short years from now, we'll be doing graduation together. My hope is that you will learn to leave with a deep capacity to notice the patient who is anxious, the caregiver who is overwhelmed, the classmate who is struggling. I only have 20 more of these. No, not really. The community who is in need. What you notice will shape how you serve. Many years from now, your greatest achievements will not be measured in credentials or discoveries, but will be measured in how you treated people. I ask you to please take this profound responsibility seriously, and you need to supersede yourself. Let it be a call each day to unite the science of oral health with the art of understanding. Congratulations. Enjoy the white coat. Every one of them becomes my child. And that's what makes it so important to me. I'm looking in the book for where I'm supposed to go introduce Dr. Fred Moore, an absolute friend, a wonderful human being. Here we go. I decided to use cards because I thought I'd cry less. Didn't work. It's my pleasure to introduce a friend, a person that I taught with for years, Dr. Fred Moore, Professor Emeritus of Epidemiology and Health Promotion. Dr. Moore earned his DDS at University of Michigan, his Master of Science in Pediatric Dentistry from University of Michigan. Throughout his distinguished career, he's been deeply engaged in dental education, professionalism, health, well-being of students, and the health professions. His research interests have included motivating students in the health professions to pursue careers in addiction research, understanding dental and nursing students' decisions regarding alcohol and tobacco use, exploring traits in the development of professionalism, examining the barriers to health care among the LGBTQ community, individuals, and factors that influence LGBT students and decisions about being visible. Dr. Moore is a life member of the American Dental Association, a member of the American Dental Education Association, an alumni member of OKU, and we are very fortunate to have him. He helped teach ethics, teach me ethics, to watch the growth of a student body and how to care for students as part of everyday teaching. Fred Moore is a wonderful person that I'm so pleased is here. In case you want
Okay,
this.
thanks. Dean Wolf, members of the faculty, class of 2030, family members, friends, loved ones, guests, welcome. This is a memorable day for everyone here. The white coat means so much in so many ways. Most importantly, it welcomes another talented group of University of Pennsylvania students into the profession. I've done my share of public speaking, but I've never spoken at a white coat ceremony. So I opened a couple of AI programs and queried them to give me 5 important elements in a keynote speech for a white coat ceremony. Now, to be candid, what I learned was kind of what I expected and not helpful. But in one of them at the bottom, it was titled Tips for Speakers. It said, don't take longer than 15 or 20 minutes. The students are eager to show off their white coats. Families want to take pictures. So work to inspire and not exhaust. I'll do my best. Of all the topics I could include, I've chosen 3. Knowledge and skill, reputation and credibility, and moral code. Now, what's important about each of these is they are under your direct control. When I was in my first week of dental school at the University of Michigan, and we didn't have a white coat ceremony. I think we had a dirty coat ceremony. The highlight was a presentation by the chairman of the Department of Restorative Dentistry. His name was Louis Schultz. He was a very distinguished man, and he had this impeccable white coat. And on the pocket was embroidered his name and department number, but in a font that only selected people get to use. He had styled white hair and a very authoritative voice. He perched on a high stool and he said, I'm here today to tell you when you become a dentist. He went on to say that we have to pass all of our courses, all of our preclinic courses, all the clinics, clinic rotations, clinic assignments, everything that goes with those. We had to have our counts paid in full, our clinic spaces cleared and cleaned. We had to have our national boards passed and the licensing board complete. And then, he said, you'll be a dentist. Oh, there was one more thing. The Ann Arbor, Michigan Police Department had an agreement with the college to withhold the degrees for any student with unpaid parking tickets. I quickly learned that he wasn't quite right. Somewhere early along the way, it became clear to me that I had become a dentist for everyone I knew the very first time I put on a white coat and started dental school. Everyone around me believed that I had the knowledge, skills, values, and beliefs that made someone a dentist, even though I was very early in dental school. I remember going home to Detroit my first year for Thanksgiving break. I guess it's a Midwest thing, but in my family, my family and extended family all went to my grandparents' house for Thanksgiving dinner. My family had lots of questions, and somehow I was the celebrity dentist. What's the best toothpaste? Which toothbrush do you recommend? My uncle at one point took me aside and he said, listen, my dentist says I need gum surgery. Do you agree? Now, in the fall term of my first year, I knew more about the nerves in the brachial plexus than I knew about toothpaste and toothbrushes, much less gum surgery. But they didn't care because I was the dentistry expert in my family. It remained to me to, as it will be to you, to gain the knowledge and develop the skill, and that'll be your major focus for your next 4 years. We don't talk much about reputation. After the admissions process, when you enter dental school, you take on the identity of a healthcare professional. You also take on the identity of your class. In addition, you wear the respect or disrespect of your patients. As a student, this may be the first time that you have an identity and an accountability beyond yourself. Now, this is good when your class has a good reputation and patients love you. But what happens when they don't? 10 years ago, at Dalhousie University in Halifax, Nova Scotia, the identity of a class was forever changed. A group of male students formed a private chat group on social media. They didn't use school resources. It was private. They agreed to keep it private. They called themselves the Gentlemen's Club. What was said in the Gentlemen's Club stayed in the club. It was a site for them to vent about the school, faculty, classes, and their classmates. Now, occasionally, some of the comments were graphic and hostile about women in the class. In spite of it being a private group, one of the group members decided to show some posts to a woman in the class who had been the subject of a misogynistic string. At that moment, the private chat became public. None of the group graduated on time, and 3 never graduated. This shows the power of your actions as a group of people in a profession where the public expects more. For every student in that class, whether they were part of the group or not, they had been held accountable. The case reverberated throughout Canada, dental education, and the profession. What's the point? Your class will quickly gain a reputation. While that reputation may change some over time, it's largely fixed. A good reputation can be affected by the actions of a few. I encourage you as a class with shared responsibility to engage in conversation, to address issues, and to establish formal and informal lines of communication with faculty, administration, and each other. Yosueli was an ethicist at Creighton University in Nebraska. He wrote about the social contract. Now, the social contract is an unwritten understanding between society and the profession. As dentists, we have many benefits and enjoy the esteem of the public simply by virtue of our profession, our knowledge and skill, and the good works of those who came before us. The public sees us as esteemed because of our knowledge and skills as a profession. Dentistry is a learned profession based on scientific evidence, knowledge, skills, professional integrity, and values the public respects. Now, applying Welly's concept as a dental school class collectively, this white coat ceremony makes you a valuable healthcare resource in every clinic situation, outreach, and all of your volunteer work. David Callahan wrote a provocative book titled The Cheating Culture: Why More Americans Are Doing Wrong to Get Ahead. The book explores how pervasive cheating is in our culture, including so-called white lies, fibs, and alternative facts. The claim that everyone does it is offered as vindication. Is that justified? In dental practice, patients can be steered toward unnecessary treatment. Insurance companies can be billed for treatment that was not performed. And students can selectively treat patients in order to meet their graduation requirements. These occurrences and others like them need to be part of an ongoing conversation about our moral code. Everyone has a moral code. Evil people have a moral code. People who lie, cheat, and steal have a moral code. Now, I hope that none of us will adopt those codes, but it's a code. For all of us, integrity is part of it. In his book titled Integrity, Stephen Carter defines integrity as having three components. Each of us has a system of values, beliefs, and standards. Second, when we engage an ethical dilemma, we may apply those values and standards in resolving the dilemma. And three, when we encounter an ethical dilemma, and less commonly, we decide to become an advocate for one or more of our standards and values. Let me give you a simple example. It may not be an obvious moral choice, but let's do punctuality. Now, this can be a core belief because punctuality is a sign of respect, self-respect, and respect for others. Faculty like to be in classes and clinics on time. Students like them to end on time. Patients like to be seen on time, and they like their appointments to end when they are told they will end. Let me suggest that arriving late, leaving early, taking longer than planned, or failing to complete the planned treatment is disrespectful. Now, let me be clear, I'm not here to be an advocate for punctuality, but it is an example of a group value that a class can consider. For many years, I've led courses in professional ethics, professionalism, and professional identity. As an institutional review board chairman at the NYU Medical Center, I have facilitated ethics and compliance and research. I have never had anyone claim they were dishonest, unreliable, incompetent, non-compliant, or simply did not care. The truth, however, suggests something different at times. Shared accountability includes being prepared, knowing what's expected from us, diligence, thoughtfulness, compassion, and a commitment to do what's best for our patients. This is a solid foundation for a shared moral code. Today, you enter the profession. The white coat is symbolic, but to everyone you encounter, it's a promise. It's a promise that you'll be knowledgeable, persistent in developing skills that will always benefit patients, mindful of your shared reputation, and a willingness to be accountable for your actions and those of others in your class. When something does not work well with a patient, and it happens, you will take responsibility and always put the well-being of the patient first. Okay, thinking back to the tips for white coat ceremony speakers, let me close with these thoughts. If someone offered to predict my future when I was a first-year student and told me that in August 2026, I would be giving a speech at a white coat ceremony for a new dental class at the University of Pennsylvania, I would have paused, stared, cynically, I'm sure, turned and walked away. It was not even a figment of possibility. Dentistry provides the opportunity for a remarkable and rewarding life. It will lead you down different paths to serve others by respecting yourself, knowing who you are, becoming the best person you can be, and being open to opportunities You will have choices for your professional life. That life begins today. On a daily basis, you'll be surrounded by people who trust you. Faculty who will help you gain the knowledge and skills to be an excellent dentist. Patients who will seriously consider your recommendations, show up for appointments, and will be grateful for the treatment you provide. You will definitely be challenged by ethical dilemmas, but you can get help to work through them. If you choose a career in general practice, you'll be an essential healthcare resource in your community. Dentistry has an array of other opportunities and choices: specialization, group practice, public service, community health, public health, the military, scientific research, business, and careers in education. The variations are limited only by your imagination. Like those of us who've come before you, we know that our profession offers you a life beyond your wildest dreams. Embrace it. Congratulations on letting me share this day with you.
I would like to,
What's the date? If it doesn't fit, it's all over.
there we go.
Thank you. Thank you.
Thank you for a memorable and wonderful.
Thank you.
Okay, it's now formal time to introduce and welcome the members of class of 2030. In alphabetical order, the students will walk up to the podium to state their names and their undergraduate institution. They will be then clocked by a faculty member on stage. I would like to introduce 4 faculty members who will be clocking each of you. Dr. Faizan Alawi, our Vice Dean for Academics. Dr. Mildred Embry, Chair and Professor of the Department of Orthodontics. Dr. Patricia Miguez, Chair and Professor of the Department of Periodontics. Each student will then proceed to center stage and be congratulated by Dean Wolf on receiving the white coat. A photograph will be taken, so don't worry about it, of each student being congratulated by Dean Wolf, and students will be able to download them. We welcome our new students into the Penn Dental Medicine, confident in their ability to successfully study and complete their studies. Okay.
Mercy Adenika Adetoyeshe, Pennsylvania State University.
Amina Akhrokulova, Muhlenberg College.
Sarah Elena Albrione, Villanova University.
Isabella Andrews, Clemson University.
Katrina Quinn Mai Arndt from Nova Southeastern University.
Cyan Aurora, Muhlenberg College.
Garam Arshad, VCU.
Sivani Arvapali, Bates College.
Liana Snoddy from Boston University.
Trisha Bala, the University of Texas at Austin.
Cameron Grace Berry, Temple University.
Kyra Butada, University of Michigan.
Alexandra Bishop, University of Miami.
Grace Bua, University of Pittsburgh.
Flora Chen, the University of Pennsylvania.
Mingxuan Chen, Boston University.
Shelley Chen, University of Pittsburgh.
UT Chen, University of Connecticut.
Yuxuan Chen, University of California, Davis.
Amelia Chang, the University of Chicago.
Sophia Chertok, Nova Southeastern University.
Sonia Chabra, UC Riverside.
Danby Choi, Barnard College. Juhi Choi, Case Western Reserve University.
Pierce Chu, UC San Diego.
Leah Yeun Chung, Emory University.
Jasmine Collier, the University of Virginia.
Olivia Helen Cornwall, Villanova University.
Emma James Costa, Florida State University.
Lauren Crosby, Wake Forest University.
An Hao Dang, University of Florida.
Archini Desai, Rutgers University.
Ayush Desai, the Nova Southeastern University.
Leah Doe, University of Florida.
Zachiel Natchif, University of Detroit Mercy. Hain Yoon, University of Michigan. Go Blue!
Gabriel Songo Felin, University of California, Los Angeles.
Eliza Ford, University of Georgia. Go Dogs.
Olivia Forty, Clemson University. Go Tigers.
Daniel Dennis Galloway, Loyola University, Chicago.
Jennifer Bale Galkin, Temple University.
James Joseph Gallo from Binghamton University.
Julia Gambino, Duke University.
Emily Raytong Gao, Vanderbilt University.
Webb Garrett, High Point University.
Human Galinoy, Youngstown State University.
Maya Garaya, University of California, Los Angeles.
Natasha Gupta, York University.
Lauren Chemin Han, University of the Pacific.
Rachel Veronica Halper, Adelphi University.
Yuran Han, Middlebury College.
Emily Hart, University of South Carolina.
Lauren Hartpence, Rowan University.
Ava Hazuri, Villanova University.
Emily Heller, University of Washington.
Matthew Tianan Hong, University of Rochester.
Melody Dame Hong, Cornell University.
Susie Huang, Cornell University.
Emily Hughes, Boston College.
Yusra Hussain, University of Maryland, College Park.
Yawan Jang, UCLA.
Wei Kai Ji, University of Texas at Austin.
Jacob Caffrey, WashU in St. Louis.
Mark Kalwash, The Ohio State University.
Jonas Liwa Kalawa, Michigan State University. Go Green!
Samra Khalid, Brandeis University.
Mia Coley, Trinity University.
Aisha Caduce, University of Florida. Go Gators!
Ashley Kim, UCLA.
Hannah Kim, University of Pennsylvania.
Hee-Jae Kim, Johns Hopkins University.
Hee-Woon Kim, University of Detroit Mercy.
Hendon Kim, University of Illinois Urbana-Champaign.
Jennifer Kim, Texas A&M University.
Minji Kim, Cornell University.
Mingyu Kim, University of California, Irvine.
Yuna Kim, University of California, Los Angeles.
Adiel Cohen-Bosch, Touro University.
Sarah Kong, Case Western Reserve University.
Anusha Kotadia, the University of Georgia.
Victoria Kurlik, Temple University.
Xavier Lacoste, Colgate University.
Isha Lahodi, Pennsylvania State University.
Justin Lamb, Muhlenberg College.
Catherine Lazarus, Northwestern University.
Casey Lee, University of the Pacific.
Charin Lee, University of Connecticut.
Ian Lee, Boston College.
Sarah Lee, University of Virginia.
Andrew Lewistine, University of Southern California.
Isabella Lewin, Northeastern University.
Aurelia Lee, New York University.
Kimmy Lee, University of Pennsylvania.
Emily Liang, University of Maryland, College Park.
June Ji-eun Lim, University of Southern California.
Catherine Little, Villanova University.
Ella Lowry, Georgetown University.
Peter Fanley, the University of Pennsylvania.
Hannah McDonald, University of Pennsylvania.
Emily Sophia Machuca, Drexel University.
Sahil Meher, Muhlenberg College.
Annie Mao, McGill University.
Edgar José Martínez Burgos, University of Pennsylvania.
Abigail Masha, the University of Pittsburgh.
Alexandra Mattia, University of Florida.
Molly McCracken, the Ohio State University. Go Bucks!
Mary Diane Merheb, Wayne State University.
Emily Miller, Stevens Institute of Technology.
Olivia Milosevic, the University of Michigan.
Mina Mirzai, Quinnipiac University.
William Luke Mitchell, University of Virginia. Go Hoos!
Maya Monica Modi, University of Pittsburgh.
Francis Moon, UCLA.
Kian Mostofi, University of Maryland.
Niharika Makamala, Muhlenberg College.
Andrea Wing, University of Pittsburgh.
Emily Wooden Wing, University of California, Los Angeles. Go Bruins!
Jasmine Peng Nguyen, University of California, Los Angeles.
Miley Nguyen Liu, University of Central Florida.
Jana Oka, the University of Michigan.
Aryan Poliwal from the University of Michigan.
Pooja Patel, Drexel University.
Tej Patel, Rutgers University.
Brianna Peng, American University.
Sabrina Perez Abreu, the University of Florida.
Allison Porta, Pennsylvania State University.
Jacqueline Ann Portigallo, Colby College.
Amy Chow, Cornell University.
Jessica Randawa, University of Pennsylvania.
Rishi Rapaka, Villanova University. V's up.
Brenda Riyad, University of South Florida.
Natalia Romano, University of Florida. Go Gators.
Matthew Rosenthal, College of William and Mary.
Violet Ruby, University of Texas at Austin.
Kashish Sachdeva, University of Florida.
Sabine Safi, Muhlenberg College.
Ria Preet Kaur-Sahota, Washington University in St. Louis.
Michael Vanit Schneider, Washington State University.
Amir Sheikh, University of Florida. Go Gators.
Kyle Shang, University of California, Davis.
Anish Sharma, University of British Columbia.
Inshura Shetty, St. Louis University.
Blake Shore, Wake Forest University.
George Chu, Vassar College.
Matthias Seelap, University of Massachusetts, Amherst.
Ashley Silverberg, University of Michigan. Go Blue.
Jordan Simon, University of California, Berkeley.
Isha Arshia Singh, University of Delaware.
Julia Sun, University of California, Los Angeles.
Shayla Spritzer, University of Florida.
Katie Sue, University of Michigan.
Hailey Sun, Wake Forest University.
Jaden Tan, the University of California, Los Angeles. Go Bruins!
Ethan Tai, University of Southern California. Fight on.
Caitlin Thomas, Florida State University. Go Noles.
Catherine Amelia Thomas, Florida State University. Go Noles.
John Timmons, Emory University.
Alexandra Todd, University of Florida.
Kathy Tran, Muhlenberg College.
Ira Tufel, Temple University.
Sairaj Udin, the University of Pennsylvania.
Pravalika Reddy Vanga, Temple University.
Nolan Wen, University of Pennsylvania.
Jacob Wong, Villanova University.
Joanne Wu, Brown University.
Megan Wu, University of Pennsylvania.
Vivian Wu, USC.
Matt Tinzia, UBC. I love you, Mom and Dad.
Ella Yeager, University of Maryland.
Selena Yang, University of the Pacific.
Srinidhi Reddy Yalimati, College of William and Mary.
Theodora Yoon, Smith College.
Han Yuyo, Tulane University.
Christina Zhang, University of Maryland.
Emily Zhang, Johns Hopkins University.
Daniel Zong, University of Pennsylvania.
Angela Zhu, Wellesley College.
Okay, a round of applause for class of 2030. Okay, I invite now Dr. David Nepa, one of our clinical group leaders, to the podium, and he will lead the class 2030 in the Penn Dental Medicine Professional Pledge.
The class of 2003 will now recite the professional pledge found in the program. In the presence of you, their family, friends, and peers, they will publicly acknowledge the responsibilities of their profession and the willingness to assume the same. I ask that the class of 2030 and anyone who is a dentist in the audience who would like to renew their pledge, please rise and follow me in reciting the pledge. Please repeat each line after I have recited it. As I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations. But stop. You gotta, I have to lead it first. Stop, 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 stop. Stop. Okay, I understand that my primary responsibility is to my patients.
I understand that my primary responsibility is to my patients.
To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty, always placing the needs of my patients and community first above my own.
To the best of my ability,
I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession.
I accept the responsibility to maintain my competence through the continued pursuit of knowledge and skills in the practice of my profession.
I will conduct myself with integrity, treat my colleagues with respect, and whenever possible, work to advance the oral health of society.
I will conduct myself with integrity, treat my colleagues with respect, and whenever possible, work to advance the oral health of society.
I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond.
I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond.
All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve.
All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve.
Please be seated.
This concludes our part of the ceremony. I invite everybody to come back to school for a light reception. Please remain seated until the class leaves the stage. Thank you, and congratulations again.